welcome, and we have a very distinguished panelist today. I thank Swadeep Srivastava for getting this top minds of the country for this discussion today, covering a range of topics. And this one is especially very relevant, synchronizing efforts, aligning CSR with national health goals. So I'll begin with you, Dr. Rizvi, about your initial remarks, and then perhaps I'll ask maybe one question.
Thank you for having us, because being a person from government, we do realize that most of the programs which the government implements is at scale. So CSR for the government, the introduction I'm just saying, is to help where the government cannot reach. So we do have a whole structure for implementing our health programs, whether it is for adolescent, maternal, child, nutrition, anything. We have a structure, but CSR is where they can plug in the gaps. So I will just stop here, because that is where CSR will have a role, because at scale implementation is already taking place. But CSR can plug in the gaps and then help strengthen and saturate the programs.
Dr. Rizvi, जैसा हम लोग सुनते आ रहे हैं, bureaucrats speak less, those in the government speak less, and to the point, that was very precise, thank you so much. But you're also in a position where you can see that how our CSR programs, because it has become fashionable to do CSR without perhaps all the time thinking, and health is something that certainly needs the highest of priorities. All of us agree on that. India, as it is growing, the Viksit Bharat dream can only become true if the health remains the priority. So any thoughts on that before I move to the next one?
Just quickly saying, because what was discussed was that India is a very young country. So for that, if you just quickly say, if you look at the population projections जो हमारे रहे हैं, तो 1950 में average age India की 21 साल थी, और 2024 में 28 साल हो गई है, और वो 2050 में जाके 37 साल हो जाएगी. तो we are not getting any younger. So any interventions which we have to do for young people have to be done right now, so that these young peoples are healthy now, they end up being healthy adults, and they're healthy and aware adults, so that the next generation which comes, when it comes, also is aware and healthy.
Prasad, you have been there, I think, where many aspire to be, and you would sure have got that macro perspective. What are your thoughts, when it comes to aligning the CSR goals with the national health priorities? What has been the success or lack of it so far in your views, ma'am?
Thank you. So again, I'll go very quickly. So I think success in a number of programs we've seen actually. So like the Aspirational Districts program, and now the Aspirational Blocks program, which has been launched recently. So of course, we'll see how that pans out, but that's along a very similar model of ADP. So I think there we saw a lot of successful collaborations between the local government, CSR, NGOs, and that's really how we can move the needle, I think, on health parameters, because generally it's very complicated and challenging. I think in terms of what we can do and what we can do better is the sustainability aspect, because you said sometimes, like you said, sometimes it can be just, we announce an initiative because it's fashionable, and then the next year we stop funding it, we move on to something else. And that is a challenge, because the fact is that when it comes to basic fundamental health issues, you need it all the time. You can't do it one year and stop the next. So I think if the CSR initiatives can be more sustainable as well, we don't always have to look for something fashionable or something unique. It could be something very basic. It could be just funding some critical equipment, in a health and wellness center or in a district hospital or whatever it is. But if you're doing it over a period of time, I think that is where the real value lies.
I totally agree, and even if incremental, but if it adds value and sustains a program, I think nothing like it. Mr. Vishal Chauhan, I think I'm sure you have had the opportunity. Ajay is not here. Okay. Dr. Yadav, you are an administrator. You are MD.
I'm currently a teacher. I'm with IHMR.
And what is your view on how companies or PSUs or corporates should focus on CSR as a powerful tool to bring about that change that is needed vis-a-vis the health sector?
So my perspective is on three domains. The first part is while many companies are willing to come forward, but they don't know where to get into the system, I'd say, and whom to approach. So that's the first part. The primary ownership of our national health programs is with the government of India. So, and it's largely, a lot of them are actually run by the state governments. So I'm looking at actually a mapping industry and a public-private partnership, a connect between the government, where the government can actually map out where are the resources actually required, and the industry can thereafter can pitch in into that particular domain. Now there are two aspects to it. One is, as my co-panelists have already brought out, one is the short-term projects like infrastructure building for health and wellness centers and such opportunities, equipping. The second is slightly longer term program where you are providing resources, training to the healthcare staff, maybe augmenting the health and wellness centers or such initiatives itself. And so that's the operational part which is there. And one very important element is, I also feel, is implementation research, wherein a lot of these outcomes which are coming out from these health initiatives itself, either the industry along with educational institutions can get into the parameter of wherein implementation research is funded, and where we are able to get better outcomes and we are able to align our programs in a much better fashion. So that's my perspective.
Thank you. That brings me to out of curiosity, Dr. Rizvi, has there been some efforts to perhaps create clusters and bring together PSUs and corporates to address, health priority, or invest in a CSR that it is more coordinated? Having been a journalist myself and having worked also with corporates, I see that most of these are very sporadic, without any coordination either with the government priorities. And so just out of curiosity and for the benefit of my audience, if you...
I think that's a very good question, because what government has also said, in fact, recently you may be aware there was a CSR conclave which was supported by the Department of Public Enterprises, which had discussed with the Ministry of Health what are the priorities of the ministry, and those priorities were showcased and discussed with the various CSR activities of the PSUs which are there. Within that, I think a few examples was sickle cell disease was there, management of tuberculosis, management of anemia, management of rare diseases where government needs help. So those things were actually showcased. I think government is going about the whole issue of using CSR funds in a kind of scientific and systematic manner. So that, I think that step has taken place, and what the priorities of government for reaching certain goals, like Urvashi mentioned about aspirational district or aspiration blocks, those coordination with CSR are there. And for these other diseases, like I mentioned, which are in the mission mode, whether it is sickle cell disease mission is there, tuberculosis is there, rare diseases for our country is there, which need large amount of funds at one time. So that also CSR cooperation. So I think we are going about it in quite a decent and scientific manner.
And you need a better communicator in Swadeep Srivastava to perhaps take it and amplify it better. Mr. Natarajan, there is swapping of seat, you were supposed to sit, but, sir, you have been, you have seen a different facet of this all, having been a director in Ministry of External Affairs. What is your perspective when it comes to global health, having dealt with some of these priorities in your tenure over a period of time?
सबको मेरा नमस्कार. मैं मेडिकल सर्विस से नहीं हूँ, फिर भी अगर फॉरेन पॉलिसी बारे में पूछेगा तो
इसीलिए मैंने ग्लोबल हेल्थ के बारे में पूछा,
लेकिन मैं कई देशों में सर्विस किया है, इंक्लूडिंग इन चाइना, इंडोनेशिया, नेबरिंग कंट्रीज़, और यूरोप में भी मैंने सर्विस किया है. मैंने यही देखा है कि मेरा पर्सनल एक्सपीरियंस भी है, सो अगर ज़रूरत पड़ेगा तो मैं बाद में बताऊंगा. लेकिन ऑल इज़ वेल, ईस्ट और वेस्ट, होम इज़ बेस्ट. मैंने हेल्थ में भी यही देखा कि पर्सनल हेल्थ प्रॉब्लम ही जब विदेश में हम फेस करते हैं, डॉक्टर के पास वहाँ जाते हैं. उदाहरण, चाइना में मेरा वाइफ का साइनस प्रॉब्लम हुआ था, सीरियस प्रॉब्लम. उनका ट्रीटमेंट वहाँ हो नहीं पाए. द लोकल डॉक्टर्स, चाइनीज़ डॉक्टर्स could not diagnose at all. So they made the case from bad to worse. So finally, I had to bring my wife back home to India to take further treatment. यहाँ इंडिया में आने के बाद ही उनका ठीक हुआ है. सो यहाँ जो जब मैं दिल्ली में ट्रीटमेंट कर रहे थे एम्स में, जब आया तो एम्स में डॉक्टर ने पूछा भाई पहले आप कहाँ ट्रीटमेंट ले रहे थे. जब मैंने सब पेपर वगैरह दिखाया तो वो थोड़ी बहुत सरकास्टिकली ही वाज स्माइलिंग और बता रहे हैं भाई चाइना के बारे में तो आपको पता है. सो अब इतना बोलते हैं चाइना इतना आगे बढ़ गया ये वो, सारा दुनिया भी बोलते हैं, लेकिन अभी भी अगर आप चाइना जाएंगे, यूरोप में भी यही हाल है. सो in my perception, whatever we are having the facilities in health sector, I think we are one of the best in the world. That's what I would say. Thank you.
Thank you. Vikramji, of course, you have been a journalist and have covered and written and seen. As an observer, what has been your understanding of the way CSR projects are being delivered on the last mile? Do you find that many of these are replicated, equally effectively in other markets, other regions? What could be done to make it more sustainable, as Dr. Urvashi Prasad was referring to?
मैं जर्नलिस्ट हूँ तो कुछ नंबर्स पे बात करूँगा तो जल्दी चीज़ें ख़त्म कर दूँगा. मैंने जो तीनों जो नेशनल पॉलिसी फॉर हेल्थ देखा, उसमें सबका एक कॉमन गोल था कि सबके पास हेल्थ का एक्सेस होना चाहिए. और आपको लगेगा डॉक्टर नहीं हूँ, बट फिर भी लगता है कि जो प्राइमरी हेल्थ सेंटर्स वो हमारे जो है मेजर फोकस के केंद्र होने चाहिए. और अभी हमने देखा था पार्लियामेंट क्वेश्चंस आया था कि आउट ऑफ 30,000 प्राइमरी हेल्थ सेंटर्स में केवल 50% से कम ऐसे सेंटर्स हैं जो 24 घंटे चलते हैं. अदरवाइज जो है वो थोड़े समय के लिए खुलते हैं और चलते हैं. अभी हमने देखा जो एक्सपेंडिंग है ना, हेल्थ स्पेंडिंग जो गवर्नमेंट का हमारे यहाँ 2% के जीडीपी से भी कम है, जबकि हम देखते हैं कि ग्लोबल बजट में बहुत सारे कंट्रीज मिला के देखें, ग्लोबल बजट का 9.8% जो है ना तक जो है पैसे हेल्थ सेक्टर्स में एक्सपेंडिचर्स होता है. अभी की बता रहा था कि 4 लाख से हमारा 7 लाख जो है वो CSR फंड्स होने वाले हैं. बट कहाँ 4 लाख 7 लाख के फंड से कुछ होना नहीं है इस देश में. बट फिर भी मैं मानता हूँ कि अगर कॉरपोरेट अपनी रिस्पॉन्सिबिलिटी समझते हैं और CSR फंड्स ठीक से एलोकेट होता है तो वही जो है रामायण में जो गिलहरी का रोल था वो CSR का भी रोल हो सकता है. अदरवाइज जो है हेल्थ स्पेंडिंग बहुत होना है. और हमने देखा, ये अभी पढ़ रहा था मैं, केरल ही एक ऐसा मात्र स्टेट है हिंदुस्तान में जहाँ पर व्यक्ति जो है ज़्यादा दवा में एक्सपेंड करता है. अदरवाइज आप जम्मू कश्मीर देख लें, नॉर्थ ईस्ट देख लें, बहुत ही लिस्ट लोगों के पास दवा की पहुंच है. मैंने देखा है CSR में बहुत सारे हमने कंपनीज को देखा है, कुछ हमने पब्लिकेशंस को भी देखा. उन्होंने खुद का अपना एक फाउंडेशन बना लिया और वो अपने हिसाब से काम करते हैं, वो फंड अपने हिसाब से इस्तेमाल करते हैं. यानी उनका जो एक मैंडेटरी है गवर्नमेंट की तरफ से कि वो पैसा खर्च करना है, तो ज़रूरी नहीं है कि सोशल कॉज पे या इस हेल्थ सेक्टर्स में करें, वो अपने हिसाब से करते हैं. तो मुझे लगता है अभी जो लोग बता रहे, जो गवर्नमेंट का मैंडेट है कि हेल्थ सेक्टर्स में पैसा जाना चाहिए, वो अगर इक्विटी लानी है, सबको बराबर मिलना है हेल्थ सर्विसेज, तो इसमें भी बहुत आगे जाना है. और इसके लिए जो है हमारा जो है CSR फंड प्रॉपरली एलोकेट हो और उसका ठीक से मॉनिटरिंग हो तो इसका रिजल्ट आ सकता है. थैंक यू.
धन्यवाद. डॉक्टर यादव, ये केवल पैसे की बात है या कहीं एडमिनिस्ट्रेशन की भी बात है?
I think it's a combination of both factors. जैसे अगर आप देखेंगे कि there are some states which have got a health denominators which are much less than what the other states are. So it is both. It is because some states have got better trained personnel, and at the same time they are using it in a much more cost efficient and cost effective manner than the other states. The issue is about capacity building for states which are catching up. They are all catching up, and there are a lot of initiatives which are actually happening in these particular states, like those aspirational districts program and all that. So I would look at it in a very positive framework as we go ahead in this thing. But there is an opportunity for CSR and for the industry to be a part of this national building initiatives.
And one last question to Dr. Prasad. Do you think, can you give us some insight on the way Niti Aayog functions and the way the policies are being framed, whatever, within permissible limits, whatever you can, so that there is some clarity as I go back and I tell my corporate friends, what should be your goal and how should you be looking at CSR?
I mean, you asked me a question I can write a book on, but okay. So how Niti Aayog functions, very, very briefly, it's a policy think tank. So the idea is to work with all the central ministries as well as, very importantly, with states in India to basically improve the functioning of their programs, to provide fresh thinking, fresh inputs, the best of research that is available domestically and internationally, and channel that into the policy making process. And of course, we also engage with a lot of external stakeholders. So, whether it's private sector, civil society, and others. So that, in a nutshell, I would say that, that is the role of the institution. And I think a lot of the work currently and going forward is going to be at the state level, helping states prepare their plans for 2047. Because as you know that, of course, we've also been working on an overall Viksit Bharat 2047 plan for the country, but we're also taking that to every state, because obviously every state needs to have its own unique roadmap if we are to achieve those goals. So I think a lot of the work currently and also going forward is going to be in that direction.
Excellent, and as you always, the ministry has the last say, and why it should be different here.
No, I totally echo what Urvashi mentioned about state being the center of all action. And that is what I would request the CSR also, because states should be able to, because you can't have an intervention which fits all the states, because there's no one size will not fit all. So intervention should always be discussed with the states. Whenever any CSR intervention is being planned, please do take the state governments on board, explain to them so that they are fully owning whatever intervention is going to take place, whatever you're planning to spend the money on, because that is where the action takes place, that is where the effect will take place. And like Urvashi mentioned, we are looking at Viksit Bharat 2047. So the vision of states is very critical right here, right now.
Thank you. That was short, sweet, and exciting. And my compliments to Swadeep Srivastava and team for this brilliant gathering and very meaningful discourse. Thank you all very much for being patiently listening to us.